Good evening and welcome to the Introduction to Digital Health and Send e-Referral this evening. I'm Melissa Wilkinson from the education team at the Primary Health Network, and I'd like to acknowledge the local custodians of the land on which we meet today and honour elders past, present and emerging. Just a bit of housekeeping. We will have a poll at the end of the session, so I strongly encourage you to complete that. It's really useful to have that feedback for future education events, and that would be really appreciated if you could complete that for us. Tonight is being recorded and it will be available in our education library on the website in the next 24 hours, so you can view that afterwards if you need to refer back to anything. Also, I encourage you to ask any questions. We will have time for questions at the end. If we don't get to all the questions, I will refer you to our education email, education@thephn.com.au, and you can submit them there if we don't get through them all. But in the meantime, if you could please place them in the chat box, we'll get to those at the end of the session. I ask you all to remain on mute as well, and I'll introduce the speakers now. So we have tonight with us, welcome Peter Mullen, who is one of our digital health officers for the Primary Health Network. Before joining the PHN in 2019, he was working as a practice manager in general practice, implementing many of the digital health elements that we'll be discussing tonight. So welcome Peter, and thanks for joining us. We also have Dr. Kathy Rainbird with us, who holds a PhD in behavioural science in relation to medicine and a senior provider for adoption lead at the Australian Digital Health Agency. Kathy is based in Western Australia, joining us tonight online, which is amazing, and has been working with Aboriginal medical services and other healthcare providers, both across WA and nationally, training them on the benefits, features and clinical use of the My Health record. So without further ado, I'm going to hand over now to Peter to start his presentation. Thanks, Peter.
Thanks, Mel. Good evening, everybody, and thank you for joining us. I'm just going to cover tonight just a few components. I'm going to mainly skim over the top. I'm not going to drill down to a lot of detail. The idea is really just to give you some basic fundamentals and probably provoke a little bit of thought within your own practice. So I'm going to cover some digital health and IT fundamentals. Then I'll just do an overview of the Send e-Referral program and BPAC e-Referral Manager, and then I'll hand over to Kathy from the agency, who'll cover a whole range of topics in the digital health scope. Okay, so let's kick off with hardware. With your hardware, I think it's important to make sure that your hardware is up to date and that it does what it needs to do to allow you and your team to work effectively. So have you got the right peripherals in place? Have you got the right scanners, printers, headsets and everything like that that allow your team to work efficiently to do the best job they can in the time that they've got? Do you have a hardware refresh plan? Hardware is always going to fail. Murphy's Law says at the worst possible time, and it will fail eventually. So it's always best practice to have a hardware refresh plan in place so it's replaced before it actually fails. Keep your hardware clean. The amount of time I've walked into practices and there's been an inch of dust over the top of the PC box or through the printers and everything like that, give them a vacuum every now and again, keep them clean. They will run a lot better, a lot more efficiently and for a lot longer. Software. Keep all your software up to date and running on the latest version. Don't unduly delay software upgrades for your PMS, which is your practice management software, your OS operating software, your BIOS and your drivers. They're all important to keep them up to date. I know some practices do delay in case there's a bug comes out, and they can sometimes miss that. But the other thing is you are missing out on patches for previous bugs. You're missing out on security upgrades. So it is important to upgrade all of those things regularly and on time, really. The other thing is that, with your software upgrades, make sure that they are actually pushed out, either run by users, pushed out through a group policy, or run by your IT company so that they are happening regularly. And don't allow users to snooze them. What can happen if users are snoozing them is they will eventually, something like a Microsoft update will actually automatically push through and just say, I'm going to run now. And I have actually seen a doctor come screaming out of their consult room saying that their computer's running an update. Why is this happening? And because that was because they've been snoozing it for a month. So it is important to run those updates regularly. Best done out of hours, obviously, because they can slow systems down. HPOS and Proto. Obviously, some of you may be familiar with HPOS and Proto. If you're not and you're entering into the digital health space, it is something that you will become familiar with. But if you're setting up your HPOS and Proto, Proto is your individual, and your HPOS is your organisation. Make sure you've got the right roles in place for your organisation. So your responsible officer, that is the person that registers the seed organisation, your organisational maintenance officer, or OMO, they're the people that can actually do the day-to-day maintenance. So in a small practice, that your RO might be your owner doctor, and your OMO might be your practice manager or receptionist, and you can have more than one OMO. So it's important to make sure they've got the right delegations to allow the business to continue, in the event of sick leave or annual leave or a resignation. And make sure that the right person can access and revoke and download any certificates that you need to, and also when those certificates are issued, because they're now only issued through HPOS and Proto, that the password is sent, where that's going to go to, and who's receiving it is actually aware that they're getting it and what it actually is, and it's not spam and they don't delete it. Speaking of your NASH and your site certificates, your NASH certificate is a security certificate. It underpins many digital health initiatives, such as the My Health Record. So after downloading it, when you download it from HPOS, make sure that you do rename it. It just downloads as a file called site. So rename it and store it somewhere where it's accessible in the event of an IT failure. I've seen practices where they've had to go through the whole process of actually revoking and reissuing one, whereas if they'd put it on a thumb drive, stored it somewhere safe, or put it on a backup drive or something like that, they could actually get up and running again straight away. Data security, it's vitally important that your patient data is secure and your own business data is secure. Your security software, is it fit for purpose? Is it updated? Make sure, again, you're running your updates on your security software and that it's actually doing the job it's meant to do. Are you receiving encrypted e-referrals? And I'll cover that in a little bit more detail down the track. Secure messaging. Do you use it? Is it used to both send and receive or just to receive? And should you have the capability for both? It's important to make sure that your patient data, when you're transferring it between you and other providers, is sent securely. And that leads me to ask about your emails. What do you use your email for? Do you send and receive any emails containing patient data? If you should, I would highly recommend you reconsider what you're doing there. It is high risk. The potential for data compromise or a data breach through email is very, very high. Just this week, I had a practice actually email me a referral that was meant for another provider. I'm not a provider, but that email was sent to me. That's a data breach. That practice has now got a record because they didn't check who they were sending an email to. The other thing is that your email is not necessarily secure. If you're using email, for example, using a fax system, and it's an eFax system such as GoFax, just bear in mind that that relies on your email system to actually send and receive those while your actual fax gets sent through a normal fax system. The system itself relies on email to create and receive the actual faxes. And now if you're operating in an Office 365 environment, for example, those faxes are being stored on Microsoft servers in the cloud and aren't necessarily secure. So unless you've got your own mail server, just be aware that that fax is not secure and it's relying on email to actually process the incoming and outgoing faxes. Remote access is a big one. Who has remote access and where are they accessing it from? You can have the best security software in the world on your server and on your work PCs, but if you've got a staff member who's remoting in and they don't have security software on their computer, they're a backdoor into your business. So just make sure with your remote access that the security on anyone remote accessing is as high as it is within the practice. And are your staff trained and regularly updated about cybersecurity? It's important that they're aware, and every day, there are threats coming through. So, just the basics. Don't click on links in emails that you don't know who the sender is. Don't open attachments, even if they're PDFs. Don't, particularly if there's something like an exe file, which is a .exe file, which will often run a program. Don't just click willy-nilly and download things. You have to be aware. If you're not aware, pass it on to your practice manager, or make sure it's passed on to you as the practice manager and that your IT review it, or you just don't open it and delete it. Contact the sender, verify what you're actually receiving before you actually go and open it, because you can download all sorts of things, and there's a lot of ransomware being delivered at the moment, and you don't that's the last thing you need is your patient files locked up. And they're targeting health organisations simply because if someone on the black market gets hold of say a credit card number, that's worth about 90 cents to them on the black market. If they get hold of a health file which contains all your patient demographic details and all the other details for the patient Medicare number, etc., that's actually worth about $100 because they can go and create a whole lot more cards. User permissions, again, do they allow your staff to work effectively within their job scope? So can the people do what they need to do, or is your system actually blocking that? Some software programs require the user to have admin access, others don't, but make sure you've got that balance right. Who needs administrator access, who doesn't? The last thing you need is also someone who doesn't need administrator access with the ability to download programs and actually install programs. Passwords. Are they changed regularly, and are they changed? Are they complex? You know, QWERTY is not a password. Password is not a password. 1, 2, 3, 4, 5, 6 is not a password. Make sure that they are updated regularly, and that, you know, again, if it's for a specific, you know, if it's for your doctor's log into their practice management system, to their profile, only they should have it. Nobody else should have it. We see regular cases reported through medical press, you know, where nurses or practice staff have access to a doctor's password, and they're able to actually, you know, write scripts and things like that. So it's important that the right people have the right password. That doesn't mean that some things can't have a shared password, but important things where it's, you know, where it's your responsibility in your PMS, it shouldn't be a shared password. Backups. Are you doing your backups daily, and are they stored offsite? Vitally important. Again, if you have a computer outage, a server outage, building fire, I've seen all of these things happen. It's important that your data is stored offsite. Can be in a cloud, can be an external drive. If it's an external drive, make sure that you're, you know, where is that actual drive being stored? I've seen them sat in the back of cars and had seen cars broken into and data lost that way. So make sure that you've got, if you're using an external drive, it's actually treated with a bit of respect. Cloud, again, where is the cloud storage actually happening? Is it stored in Australia? Is it overseas? It is best obviously stored in Australia where you've got backup, sorry, where you've got where it's a known provider, I suppose is the best way to put that. But also make sure that it can be backed up from the cloud. A secondary server is sometimes an option. If you're upgrading your server, why not turn the old server into a backup server if it's still functional, and that way you can you know, have that backing up, and it means if you do have a primary server failure, you can be back up and running in a fairly short space of time. The other thing is there's no point backing up your data if you can't actually use it to do a recovery. So make sure you test your data, your backup data, to make sure you can actually get back up and running in a reasonable space of time in the event of a failure. Policies and procedures. You know, have you got in place social media, email, internet, secure messaging, My Health Record, eScript, data records? All of these procedures should be really in place, particularly, you know, if you're using My Health Record, for example, which Kathy will talk about later, you need to have a My Health Record policy in place. The other thing is, put my teeth back in. Does what you say in your policy and procedures manual match what you actually do day to day? It's not just something you write down and forget about. You actually need to walk the walk as well as talk the talk. IT consultants and suppliers. If you use an IT, do you use an IT supplier or do you do it yourself? If you're doing it yourself, do you actually have the knowledge to do all the things that you need to do? I would suggest in the current environment, that's probably a very limited number of people. You'd want a pretty good IT knowledge to be doing it all by yourself these days. Does your IT supplier have specific health industry knowledge? Do they consult with you, or do they just do the work and send you an invoice? You really, as a practice manager or a practice principal, need to be across what work your IT people are doing, why they're doing it, and how it actually impacts on your business so that you're making the decisions in consultation with them. Do you know all your IT administrator passwords? I've dealt with practices where they don't know how to access different things. They don't have access to those passwords. And again, in a business continuity sense, if something happens to your IT supplier and you need to change suppliers quickly, you need to know what all of those things are. And if your IT supplier is not willing to give those to you, or have you have access to those, you probably need to ask yourself the question if the IT consultant is working for you or you're working for them. I'll move quickly into Sent e-referrals and the BPAC referral manager. I mentioned earlier about are you receiving e-referrals? The Sent e-referral program or project is a joint initiative developed by the PHN, Hunter New England Health Pathways, Hunter New England Health, in partnership with the software vendors, which is BPAC Clinical Solutions and Streamliners. And the aim was to implement a whole of health system secure e-referral solution for local GPs, specialists, allied health professionals, and other primary care providers. And that's been implemented across both the public, non-government, and private sectors. And it's if you like, it's a similar system. Best comparative I can make is to secure messaging systems like Argus or HealthLink or Medical Objects, but it's actually it's a referral tool rather than just a secure messaging system. So what Sent does, GP creates a referral in Sent. Sent delivers that encrypted e-referral securely, point to point, using HL7 clinical document architecture. That's just an IT speak for it's very secure, and it's got it's an interoperable data set that sits behind it. The system system security meets and exceeds the current Digital Health Agency standards. Referrals are constructed using specialty-based e-forms, and so that's across the different specialties, whether that be pediatrics, orthopedics, endocrinology. There are specialty forms for each of those different specialties, and it incorporates locally agreed content designed to improve referral quality. So the aim is to stop some of that toing and froing between the specialist clinician and the GP to try and make sure the specialist gets the right information the first time. And yeah, Sent results in a more comprehensive referral than those produced using a PMS template sent by secure messaging services or fax. They're pretty limited, the information. You can't attach imaging results and things like that, whereas in Sent you can actually attach imaging results, pathology results, and all those sorts of things come through as part of the referral. I mentioned the specialty form information. This is actually a screenshot of what the GP sees. So there's 66 different clinical areas. So the GP searches by either specialty or by condition. So in this case, neurosurgery and spinal pain. There's 167 condition specialty e-forms, 786 specialty/condition pairs. So again, neurosurgery, spinal pain, or endocrinology, diabetes. They're all different examples of the sorts of things that are in the form that the GP searches for. They don't actually search by name, and the idea is that they can only refer to a service or to a specialty or to a specialist that actually sees the condition that they're actually referring for. And you can see then the form takes them through some specific, in this case for neurosurgery, spinal pain, some condition and specialty specific information is provided to the specialist so that they're getting that information that they want and need to be able to actually triage the patient and stop that toing and froing. Private specialists and the allied health professionals are listed in the software by consent and after approval of the applicable conditions that relate to their practice. So we don't just dump in a whole heap of generic conditions. For example, if you've got an orthopod who only sees shoulders and neck, but doesn't do knees, we won't list knee surgery against something that they see. We'll only list the neck and shoulder injuries. Sent is aligned to Hunter New England Community Health Pathways. I've got the address there and the username and the password. This is being recorded, so you can jump back in and grab that. But also, if you need, I'll put some contact details later. If you want to get that information, just grab that from me. The website is designed for clinical use. It's not designed for patient use, so please don't pass out the username and password, but they are generic for all users. What I would suggest is anyone listening in, go in, have a look, and make sure your listing is up to date. And if it's not up to date, you'll find a send feedback button on every page within Community Health Pathways. All you need to do is just mention the service that you're from or the specialist office that you're from, and let us know the details, and we'll update those both in the health pathways. If you're not listed there, again, you can still do the same thing, and we'll update you and put you into the practice or contact you and make sure you're in that software. Sent itself integrates with the two primary GP PMSs or practice management softwares. That's Best Practice and Medical Director. And 90% of the eligible practices in the Hunter New England local health footprint are live and able to actually send e-referrals. Not all are across it at the moment, but we've got about 90% of the 90% using it. And to the end of May, we've had over 60,000 secure e-referrals delivered and created and delivered securely. As a private specialist or a private receiver, those referrals, you receive them into what we call the Referral Manager Portal or the BPAC Referral Manager Portal. So sent referrals are received into the portal, and the practice is advised by email when a referral is created or received by them. All they do is they click on a link in that email, and that will take them to a secure website. The website's accessed using a login, which is an email address, password, which is specific to the practice, and a digital certificate. That can be your NASH certificate. If you're registered for eHealth, you don't need to get another one. Or sorry, for My Health Record, you'll need a NASH certificate. But if you're not registered for My Health Record at this stage, you can also, BPAC will also issue one, and you can use that as and all that does is verify your bona fides to access that portal. It all sounds very complicated, but trust me, it's nice and simple, and we're here to help you all the way through and get it all set up for you. User access can be structured to meet the individual practice needs, so you can have different levels of access and different people in the practice, so it's not just one person accessing it. If you think of it like a fax machine as they're coming in, we really try to replicate how referrals come into your office by the fax, and then we replicate that in a secure electronic sense. Not a lot of software required. As I mentioned, you just need the digital certificate, and then you just need the current version of a web browser, Internet Explorer, Edge, or Chrome. For those Mac practices, it doesn't work with Safari, but again, you've got Chrome as an option that you can use in there, and we'll set that up for you as well and take you through that setup. Referrals can be managed within the portal, so if you don't actually use an electronic PMS, if you're a paper-based office, you can still receive these referrals, and you can just print them out of there, or you can download them onto your PC, and they can be dealt with that way. They can also be downloaded and imported into your practice management software. So if you're using Genie, for example, they can be just imported straight into your Genie software from that downloaded PDF. We just download it into a file on your desktop, and then you can upload it into your your patient file in your PMS, or they can be printed out. Some practices or some specialists like to handwrite notes on them, and then they're scanned back into the patient file. So we can fit in with any practice's referral flow or workflow. There is also a planned future development for Genie integration. So instead of going into Referral Manager, the referrals will actually be generated and directed straight into the doctor's inbox. So that will save that step of having to log in and download them. But I can't put a timeline on that one, but I believe we're looking at that as well. That's pretty much it from me. I hope I haven't gone through too quickly. If I have gone over anybody's head, or if there's questions that you wanted to ask, please don't hesitate to get in touch. You can see the contact details for our team there. Don't hesitate to call any of us, and more than happy to talk through either any of the information you see tonight, and in particular the Centre referrals and the referral manager. And I might finish there and hand over to Kathy.
Thanks, Peter. I'll just pull up my slides, and if you could just let me know when you can see those.
Yep, looks good.
All good, excellent. Thanks very much, and good to be here. I'm going to provide a bit of a different slant to Peter, and interesting to hear some of those technical background issues. But I'm going to be talking more about the broader sort of context of digital health in Australia. So let me press on. As I am sure most of you are aware, the Australian Digital Health Agency's been working across the country with a range of different stakeholder groups, including primary health networks, as well as clinical peaks and others, and state jurisdictions to deliver the Australian National Digital Health Strategy. And there's a range of digital tools that are available now as part of that strategy to help you in your work situation and clinical practice. And some of those that I'll be touching on briefly are listed here. And of course, with COVID-19, we've seen great leaps and bounds in terms of accelerating the use of these tools and seeing the benefits of using these tools. In particular, I'm sure many of you now using telehealth that perhaps weren't previously, and hearing about electronic prescribing, secure messaging, and of course My Health Records. So I'll go through each of those in a little bit more detail. To start off with a brief overview of electronic prescriptions. As most of you may be aware, previously paper prescriptions were the only legal form by which medicines could be supplied. They had to be a signed paper prescription. But now electronic prescriptions have been passed, legislation's been passed to allow electronic prescriptions to meet those requirements. So they can now be used in place of a paper script, and they can be just created through, if you have clinical software, that can be generated through that software and sent through to the patient. They are not mandatory, and of course you and your patients can choose between having a paper or electronic prescription. Of course, with those places going into lockdown across the country, the rollout of electronic prescriptions has been fast-tracked to ensure that people who couldn't have face-to-face prescriptions and face-to-face consultations could still get the scripts they needed and send them through again to their pharmacy and have them dispensed from remote as well. So this is just a little snapshot of the sort of evolution of prescriptions, if you like, and that first picture, of course, is the old style handwritten script. The next two are both looking like computer scripts, but they're actually still a paper script because the paper script has to be signed, and that's the legal entity. But the benefit, of course, of having them printed is that they get around the issues of clinicians' handwriting. No offence to any specialists with perfect handwriting who are on the call today, but for those of us who don't have perfect handwriting, it certainly reduces those chance of error due to that. The next script along that you can see on this screen with the barcode, that barcode enables the dispenser to scan the code and pull down some key information about the patient, not about the actual medication that's listed on here, but at least some details of the patient's background, but it's still a paper script. Finally, the last screen, which is a mock-up of the token that comes through as part of the, or QR code that comes through as part of the electronic prescriptions. The electronic script is actually sent and stored to what's called the prescription delivery service. So this is not a code that takes you to the script itself, but it's a key that allows the pharmacist to unlock that electronic prescription. So that token is sent to the patient's phone or to their email address, and then they can walk into the pharmacy or send it to the pharmacy if they're in quarantine or isolation, and then they can have that filled. And so the pharmacist scans it and it's pulled down from the prescription delivery service through their scanning systems. So there's a number of options available for the management of electronic prescriptions. Of course, the patient can receive their token on a mobile phone or via SMS or via email. They can also have it sent to a carer or their agent who can take it to the pharmacy on their behalf. There also are a range of mobile apps that can be used to store those tokens. But of course, with many patients with multiple medications, it can be a bit tricky to keep track of all of that. Those apps are quite helpful. But now there is also the option of an active script list. So that means that rather than needing to have those tokens, the patient can walk into a pharmacy and say, I've had an electronic script prescribed, and the pharmacist can look up their actual active scripts from the pharmacy end, provided the patient has consented to them to look at that list, and download the prescriptions from that prescription delivery service again that way. So the key benefit, of course, is that it can mean that there's a reduced risk of medication errors and improved efficiencies in terms of less paperwork, reduced misuse of prescriptions and reduced duplication, and hopefully improved medical compliance along the way. In terms of secure messaging, Peter's touched on that a bit earlier in the piece, but I think just to highlight that faxes and emails are not a secure way of sharing patient or clinical information, and they are open to hacking potentially. And secure messaging is a way to ensure that your messages are securely encrypted from end to end, and there is less chance of that type of security breach. It's shown to reduce errors in terms of transcribing and also in ensuring that messages are received at the correct place, as per Peter's example earlier on, getting sent an email of some patient's referral information, certainly inappropriate, and you'd never know which fax number has been inadvertently entered into a system. So you do need to be aware of that issue. With secure messaging, you get a message back acknowledging receipt at the from the provider end, other provider end. So as I said, it allows for that secure provider to provide a messaging, and it's securely exchanged so that it's encrypted from end to end. And the agency is working with the different secure messaging providers to build the interoperability into the system so that you'll be able to message anyone regardless of which system they use. But in the meantime, it's really good to indicate which system you use so that the providers who you are within your clinical network can potentially use their secure messaging system, and you can communicate easily with each other. Of course, benefits include the improved timeliness of receipt of referrals and clinical information, although that's referral process that Peter referred to might come around that as well. Better informed care due to the right information being available to you, access to a broader range of referrers, and streamlined administration due to reduction in paper-based processes. I turned up at one clinical practice and there was a whole lot of information in their computer, and the clinician said, "Oh yes, we have it all come into our computer automatically." And then their practice manager said, "No, we get them on the fax machine and we have to scan everything in." So the time involved in that was huge, and the clinician didn't realise that that was what his practice staff were spending a lot of time doing. And of course, the big benefit is improved coordination of care with that improved coordination between healthcare providers. The other big growth area, particularly as a result of COVID, but has been going pretty well for some specialists for some time, is telehealth, and having a consultation either via video or over the phone. It's been a huge uptake, and I guess the great thing about the last 12 months is the readiness of people now to adopt these technologies and be prepared to have a discussion online rather than having to have it face-to-face necessarily, where suitable, of course. There are a few things to consider when you are undertaking telehealth consultations in terms of security and setup. You need to think about the appropriateness of your room and space and making sure confidential information isn't visible to others. And you need, of course, when you are starting the appointment, to check that the person you are speaking to is the right person, and making sure that there aren't other unauthorised participants on the call. The Digital Health Agency has a range of resources that can help you with setting up your online video conferencing technologies, and things to consider in terms of choosing the right one, and not necessarily just using those that are free, such as FaceTime or Skype. And making sure, as Peter mentioned, keeping your operating system and software up to date, and keeping general computers different from work computers. huge benefits for telehealth, especially in Australia, especially for those of us who do live in a more regional area in terms of reduced travel and expense and time away from home, and of course, which can mean that you see more patients and reduces the number of patient no-shows. It also just improves equity of care for people who do live in regional areas. Other benefits for you as specialists is that can help informal knowledge transfer by having consultations with your peers or other colleagues, and reduce professional isolation if you're working in a distant area. So now I'd like to focus a bit more on My Health Record. If you aren't aware what it is yet, I'll give you a bit of an overview and then highlight how you can get connected to the system. So My Health Record is a way of having key health information available whenever and wherever it is needed. So it doesn't replace your existing clinical records or however you store your information in your practice, but gives you potentially access to information that you may not have directly received. So it's an online summary of an individual's key health information, and it is securely stored online as a repository that's then accessible anywhere. It is personally controlled in that an individual gets to choose whether or not to have a My Health record in the first place, and also they can put an access code over their My Health record if they want, and then only those healthcare providers who they give that code to can access it. I should also mention that it is only accessible by the individual themselves, or if they have a trusted nominated carer involved in their care, they can give them access to their My Health record, or registered healthcare professionals who are working in an organisation that is registered to use the system. And that's part of the security behind the system, is the process that you have to go through to get set up to actually register your organisation. The beauty of it is that it is part of a national system, and I'm sure for all of you working across the health system, you're aware of how siloed and fragmented it can be and how the different computer systems don't talk to each other or share that information. This enables that information to be held in one place and crosses those boundaries. So if you're seeing people who are travelling from interstate, and people are more travelling within Australia now, you'll be able to see their key health information. It also crosses the public-private divide, so public hospitals and private providers are able to access the information. And of course, the beauty of it is it's accessible at all times as long as the internet's working, which means that if someone ends up in an emergency department, you can access that information without having to call back to the GP practice that might be closed out of hours. There's also a number of security features that underpin the My Health record system. In particular, any software that is looking to connect to the system has to go through a rigorous process of making sure that their software meets technical requirements, and they need to have appropriate encryption working across the system as well. There's also firewalls in place, and the agency has a cybersecurity monitoring system in place to make sure that monitor the usage of the system. As many of you probably are aware, we went through a process where people could opt whether to have a My Health record or opt out, but most people didn't, and so majority of patients who come through your door will have a My Health record. In fact, 22.94 million Australians as of April 2021 have a My Health record. And interestingly, even since we went through that opt-out period, people who perhaps were thinking about whether or not to have a My Health record have now been opting into the system. So I think some people were sort of waiting to see how it went and are now feeling a bit more reassured that it does have that safety and security in place. In terms of what's inside, and there's been a lot of work being done, particularly by primary health networks across the country to get information flowing into the system, but also across hospitals and other parts of the healthcare sector. And you can see that already there are over 2.81 billion documents that have been uploaded. So there's clinical documents, there's medicines information, consumer entered information, and Medicare documents that are all now available readily at your fingertips through My Health Record. As I said, PHNs have been great in getting GPs and pharmacies connected to the system, and you can see the number of that are registered and already connected and able to use the system listed there. Also, the agency's been working with state health jurisdictions. Public hospitals are connected, majority are connected and able to allow viewing for all of their clinicians. So if you're working both in public and private practice, check out your hospital, talk to your health information manager and find out how you can access it. I was looking up the information for your region, Hunter New England region, and all the hospitals across that part of the world are connected to public hospitals. And we're also working with private hospitals. And that means that you can see My Health Record and access it and use it, but also that the information coming through from the discharge summaries is also uploaded into a person's My Health Record. So when they end up somewhere else, those healthcare providers can quickly see it. In terms of the number of the clinical content and number of documents that are in the system, you can see here that we've been working with pathology services as well to get them connected to the system. Not all pathology labs are connected yet, but more and more coming online, and you can find a list of those that are connected on the My Health Record website. But there's over 100 million pathology reports have already been uploaded in there. And you can see here quite a number of diagnostic imaging reports, dispense reports, and 10.6 million discharge summaries. So that clinical content and significance is really starting to make it worthwhile for you to utilise the system, and chances are you'll find something of use when you look at someone's My Health Record. These are the different types of documents that are currently available in My Health Record, and there is ongoing work to enhance the system and add additional documents into the system as well. But these are the ones that can currently be found in there. On the right-hand side are documents that are uploaded by healthcare professionals themselves, and that shared health summary is a document that's uploaded by the GPs and can contain some really useful background information. So it's worth having a look out for those. The other thing to highlight is, of course, that pathology reports are available, so you don't have to reorder a test that's already been done. I won't go through that full list, but just to highlight also that individual consumers or patients can log into their My Health Record through MyGov and add information in the form of a personal health summary. If they do that, any of that information is clearly indicated on the record as being patient entered, so you can see that. Individuals can also upload advanced care planning documents. So if they've gone to the effort of putting together their plans and wishes or advanced health directive, that can be uploaded and stored in their My Health Records, so that wherever they go, if they do have to have end-of-life decisions made, that their wishes can be respected. Medicare documents also come through into the system, and that can be useful in terms of seeing when someone recently had particular MBS item numbers claimed. So practice managers, so you can feel your ears pricking up at being able to check when someone last made a particular claim. Also being able to check the immunisation register. You can see now, because it's mandatory to report COVID-19 vaccinations through into the immunisation register, you'll be able to see if a patient is up to date with their COVID-19 vaccinations as well. The other thing to mention is these overview documents that are listed around this circle here, and they're actually generated by the system and a part of those sort of enhancements to make the system work better for you as clinicians, to make it easy to find the information you need really quickly. The one that I'd really like to point out is this medicines information overview. As you can imagine, many of the documents that are listed here could have medicines information in them. This medicines information overview brings it all together on one screen, so you can quickly and easily get an overview picture of that and navigate to those source documents if you need them. Likewise, there's a pathology reports overview screen which brings together any tests that the person's had uploaded into their My Health Record, their results, so you can see them listed and go to the report that you need. And there's a new, very, very new, just been released immunisation view, which brings both the information from the Australian Immunisation Register and any other documents where there may have been an immunisation recorded, and displays them in that view. So this is just some screenshots. These are fictitious patients, but it's just to give you an idea of the sort of layout and look of the documents once they go into My Health Record. The Shared Health Summary is generated through the general practices software, and it's usually uploaded by the person's main regular healthcare provider. So that would usually be a GP, it could be a registered nurse, or it could be an Aboriginal health practitioner. But you can see those key headings that are highlighted in that, circled in red there. So immediately extracts that out. So if you have got a fairly sparse referral that's been sent your way, then you can look at the Shared Health Summary and get a quick snapshot of the adverse reactions, medications, medical history, and the immunisations that were given at that particular practice. This is too small to read, but just to give you that indication that hospitals are uploading discharge summaries. And of course, that can be a wealth of information. If you're seeing someone who's been in hospital since a referral letter was sent your way, you could be able to find that discharge summary and access it immediately through My Health Record without having to request it from the GP practice or the hospital themselves. This is a screenshot of that medicines information view that I mentioned. So you can see there's all of those list of documents on the left where medicines information can be found. But on the right, there's that navigation panel, and the medicines preview is highlighted here, and the list of medications underneath by active ingredient, brand, directions and dose, and over here the link to the source document, so you can get through to that if you need to. I should point out that many of the clinicians that we work with at the agency mention that this medicines information view is their go-to point in My Health Record because it gives them such a quick snapshot that's really useful. Gives you allergies and adverse reactions, the medicines preview, as well as hyperlinks to the most recent Shared Health Summary, and if they had a discharge summary, a link to that. So it just gives you that easy navigation to find some of those key documents really quickly. This is just an example of that allergies screen. So you can see the allergies bar in pink, and underneath the actual substance or agent and the manifestation of that allergy. And there's an example of that patient entered details. So you can choose to take that as you wish. Of course, all of this information, you need to use your due clinical judgment when viewing the information. And this is a screenshot of the new immunisations view that I mentioned with the Australian Immunisation Register tab here and the immunisation status, as well as COVID-19 immunisation status listed with details underneath. So in terms of how you can use My Health Record in your private practice, if you are in private practice, there are two ways that you can engage with the system, either through your existing clinical information system, as long as that software is conformant with My Health Record. And as I said, there are technical requirements that the software providers have to meet before they can enable the switch on. So if you can check, we have a list of those softwares that have met those requirements already, and that's through this link that's provided here. Using a software system allows you to both view and upload information into My Health Record. The other option is to access My Health Record through what's called the National Provider Portal. So that's useful if your software isn't conformant or you're not using a clinical software system, but it gives you read-only access, so you can't actually upload anything to the system through the provider portal. But as I've hopefully highlighted to you this evening, there is a lot of really valuable information available in the system now, and it is worth going to the effort of logging in through the National Provider Portal to be able to view those documents that you wouldn't have otherwise received. For those of you who do use specialist software, just to let you know that the agency has partnered with a number of specialist software producers or vendors to integrate with My Health Record and make it easier for you to send your letters up into the system as well. And there's a list of the vendors who are currently working towards implementing this. A number of them have already released their new products, and the others are due to do that within the next month. All of the ones listed here. I should also mention that this is the first round of that software industry offer. We've actually got a second tranche underway. So there is a whole another group of software vendors working towards this integration as well. So that's good news. So as part of that offer, they're working in terms of getting some enhancements into the clinical information software, including making sure that they're presenting that medicines view, the pathology view that I mentioned, diagnostic imaging views, as well as having that seamless upload of specialist letters and prescription records. So that's really exciting, really. So in terms of setting up to be able to use the system, there's a few things that you need to do if you are in private practice. And as Peter mentioned at the beginning, you need to ensure that you have a My Health Record policy in place. We have a link here which has some resources from the RACP, and they do have a policy template that you can use and adapt for your organisation or your business. You need to register your organisation to get connected to My Health Record, and it needs to be the person who has the responsibility for the organisation or the business who does that registration process. And as Peter mentioned, that's done by logging in to what's called HPOS and registering there. There are step-by-step guides that can take you through that process, as well as the PHN can help you with that. You do need to make sure then that your staff have training and confirm who should be authorised to have access, and make sure your software is configured appropriately for that access, and make sure you're meeting the ongoing participation obligations, including making sure that your data is stored securely. So as I mentioned, if you do need support with getting through that process of registration, there is information on the website, but we also have a specialist connections team at the agency, which can be contacted through this email address, or you can reach out to your primary health network, Hunter New England Central Coast, through this phone number or this email address, and they will help you out. Finally, just to highlight a couple of really useful resources around digital health. We have a dedicated digital health resource for specialist practices, which includes guides, implementation, printable information across all of these different digital health topics. So telehealth, electronic prescription, secure messaging, My Health Record. There's also some CPD modules available as well, and really useful printable guides. So that's available from this website here. We'll be sharing the slides afterwards, so you don't need to quickly scroll that down. The other thing is once you, if you do have one of the software systems listed here or you're using the provider portal, the agency is running some virtual classroom sessions which show you with a live little demo through a software simulator what it looks like and how to access that key information that you might want to use. We also have some particular sessions that are practical tips for practice managers in terms of understanding your compliance requirements, the things that you need to have in place for your practice around using My Health Record. And I think I already mentioned, but RACP have a great collection of resources, particularly around My Health Record, and there's a link to their policy template at the bottom of that screen. So now I will hand back to Melissa, who will guide us through questions for this evening. Thanks, Melissa.
Thanks for that. Yes, we've had a couple have come through. So if I'm not working in a large organisation, for example, a hospital, how do I register my organisation?
Yeah, so I think that the steps, there is a bit of a process. The main one is the first one that Peter mentioned, is setting up to make sure you have a Proto account or provider digital online access. And then from there, going into health professionals online services and registering your organisation. And again, Peter can, I'm sure, guide you through all of those steps.
Okay, we also had a couple of questions around security and uploading information. How secure is it and how do we know it's safe?
That's always a question that we get asked, and that's why you need to have what's called that NASH Digital Security Certificate. So that actually is what encrypts the data from your end. That's why you have to download that and install it in the back end of your software system. That then ensures that the information is encrypted as it's transmitted between your system and My Health Record. The other thing to mention about My Health Record is that all use of the system is very, very trackable. So you need to make sure you're using it for legitimate purpose. And as long as you're providing healthcare to that person, that is legitimate purpose. If you're a healthcare provider using it for that purpose, then you're fine. But don't just jump into anybody's My Health Record and have a look, because that would be inappropriate access and it can be followed up to make sure.
Okay, great. And how often is security upgraded and updated?
Constantly. we have patches and releases coming out very, very regularly from the agency, and there's all sorts of technical security upgrades happening in the background all the time.
Great, okay. And that seems to be all that's come through so far. If anyone else has a question, I'll just give you a couple of minutes to pop them in the chat box. I want to thank everyone for being with us this evening, and just remind you too that the poll will pop up after this session, so if you could please complete that. Also, there will be a copy, as we've said before, of the presentation. We are being recorded tonight, and it will be available on our website in the Education Library. We've also got another question saying, how do I get involved in SENT?
Yep, I'll take that one. Our contact details were there in the presentation, but more than happy to take a call. My mobile number, if you want to jot it down, 0448 849 916. Just give me a call anytime.
Great, thanks, Peter. Okay, well, I'd like to thank you both for being with us here tonight, and thank everyone for viewing online as well. Have a lovely evening, and as I said, it'll be all available on our website in 24 hours. So thank you. Good night, everyone.
Thanks, everyone.
Good night.